Hello, my name is Colleen Hughes. I am the Executive Director of the Westmoreland Drug and Alcohol Commission.
And I'm Dr. Mark Fuller, the CEO of Value Behavioral Health. In an effort to combat the alarming drug epidemic in Westmoreland County, we have collaborated with Westmoreland County Behavioral Health and Developmental Services and Southwest Behavioral Health Management to develop an educational video series designed to increase awareness and educate community members. Hello, I'm Dr. Mark Fuller, the CEO of Value Behavioral Health, and on this video we're going to talk about drugs of abuse. Each year, over 1 million individuals are seen in emergency departments due to substance abuse. The most commonly abused substances leading to these emergency department visits are alcohol, cocaine, marijuana, heroin, and stimulants. 40% of all hospital admissions have alcohol or drugs associated with them. 25% of all hospital deaths are related to alcohol and drugs, and this accounts for 100,000 deaths per year. In addition, intoxication is involved in almost half of all motor vehicle accidents and all murders. Now, given these alarming statistics, let's talk about what kind of drugs are most commonly abused. So why are some drugs abused, why others are not? Do medications under consideration have abuse potential? There are many drugs that have no abuse potential at all. So examples of this would be aspirin, antibiotics, and high blood pressure medicine, to name just a few. So which are the drugs of abuse, and which are the ones we need to be most concerned about? So there's two relevant questions that we ask when looking at is a drug abusable or not. And the first is it rewarding to take? That is, does it have a positive feeling in an individual and a positive effect on their brain when they take it? And the second is, does it cause dependence? That is, if you take it over time, do you need more and more and more, and do you become dependent on it for daily life functioning? So the drugs of abuse fall into 4 categories. These 4 categories are stimulants, or what some people call uppers, sedatives, or what are sometimes referred to as downers, hallucinogens, and opioids, or pain pills. We're going to take each one of these categories and discuss it in depth and look at the various kinds of drugs that are involved in each of these categories, as well as their effects on individuals. So we'll start with the first category, stimulants. These are sometimes known by street names such as speed or crystal meth, but also include illegal drugs like cocaine and prescription drugs like Dexedrine or Adderall. Some of these drugs, like the last two I mentioned, have medical uses and are prescribed at times, but can also be diverted and abused. The next category of drugs of abuse is sedatives. Now, sedatives are sleeping pills or anxiety pills or have been called nerve pills, involve drugs like Valium, Ativan, Xanax, Ambien, and Klonopin, to name just a few. But the most commonly used sedative is alcohol. Now, we don't think of alcohol as a drug, but it indeed has medical and biochemical effects on the human body and the brain. And those effects are in the same category as Valium and Ativan and Xanax. So it's a sedative drug. And because those drugs look very much the same, it's one of the reasons why people that are prescribed those medications are warned not to use alcohol with them because of the additive effects of taking 2 of the same class of drug. The next category of drugs of abuse are hallucinogens. Now, these include commonly used drugs such as marijuana or LSD, mescaline, and mushrooms. And more popular recently have been the so-called designer drugs such as ecstasy and MDMA. The 4th category of drugs of abuse are called opioids or pain pills. Now, this category includes drugs such as heroin and morphine, but also OxyContin, Percocet, codeine, and methadone. So many of these drugs are commonly prescribed for medical conditions. It's not uncommon after having a surgical procedure or an injury to be prescribed some of these medicines. And when taken under a doctor's orders with their direction, these are not drugs of abuse. It's only when they're taken in non-prescribed ways or they're diverted from the prescribed ways, that is, someone buys or sells these medications to individuals they were not prescribed for, that's where we start to see abuse. So let's talk a little more in depth about some of these drugs, and I want to start with the stimulant category. So stimulants or uppers in medical practice can be used for a variety of things. We primarily use them for disorders of concentration in children. So this would be attention deficit disorder or attention deficit hyperactivity disorder. So it's not uncommon to see children suffer from these illnesses to be prescribed these medications. This is not an abuse of these medications. As long as they're taken under the doctor's direction, that's a perfectly acceptable medical use. Some of the stimulants that are prescribed in this way are called methylphenidates. This would be the Ritalin, and Ritalin has a number of sort of cousin compounds, but also another class called the amphetamines, and most of these are variants of a medication called dexedrine. And these, again, are commonly prescribed medications. As long as they're taken under a doctor's direction, they're fine. It's only when they're diverted by individuals they were not prescribed for or taken in a fashion that's not what the doctor prescribed that we begin to see patterns of abuse. There are also illegal stimulants. And so a common category of these is called speed, which involves a variety of different drugs, many of them dexedrine or Ritalin or derivatives of that. Also, crystal meth is a unfortunate and very deadly and destructive drug, is also unfortunately a commonly abused stimulant. And then included in this category is cocaine. So we sometimes think of cocaine as a different kind of drug, but indeed it is a stimulant and works very similar to the other stimulants. As I mentioned, some of the medications that are prescribed stimulants would include Ritalin, Concerta, Daytrana, Dexedrine, Adderall, and Vyvanse. There are certainly a number of others, but these are some commonly prescribed drugs. And again, as long as they're taken under the direction of a physician, they're fine. It's only when they get diverted that we begin to see problems. So what kind of problems does stimulant abuse cause, and what are some of the reasons why people would take these medications? So a number of things happen when you take stimulants. One is some people experience a feeling of heightened well-being, or in other terms, euphoria. They feel really, really, really good. They feel a sense of increased energy, increased productivity. Many people feel their concentration is improved. They notice a decrease in appetite, along with a decreased need for sleep and an increased interest in sexual drive. So all of these things are some of those positive effects I talked about earlier that lead these to be drugs of abuse and lead them to be taken outside of normal, regular prescriptions and lead to potential abuse or dependence. Now, I mentioned some of the reasons people take these medications or abuse these medications are for those positive things I mentioned earlier, but there's some very toxic things that also happen with stimulant abuse. So one of those is irregular heartbeats. Now these irregular heartbeats can be minor or they can be major, and they can result in life-threatening heart conditions. So this is a very dangerous and toxic side effect of stimulants. They can also raise the body temperature to dangerous heights. And by increasing the metabolic rate of the body and increasing the energy of the body, they also raise the body temperature, which can be very dangerous for the organs of the body as well as the brain. Another side effect when these medications are taken outside of a doctor's prescription is seizures. So they can cause a form of epilepsy and can result in very dangerous effects on the individual. Also, in short-term use and particularly in long-term use, these can lead to irritability. That euphoria that some people experience early on changes over time, and instead they make people feel bad and uncomfortable and easily irritated. This can progress to frank paranoia, where people become unnecessarily frightened and worried and concerned and think people are out to get them. So this is a very dangerous side effect because it can cause people to act in dangerous ways and fearful ways, and is also very distressing to the individual taking this. So part of the risk of taking these medications once or twice, and I should say abusing these medications once or twice, is they can become habit forming. So the individual thought they were only going to take it once, they were just going to take it on the weekend. People find over time that they end up taking more of these medications. They take them for longer periods of time, and they take them in higher doses, which can result in drug dependence and many of the side effects I talked about earlier: seizures, irritability, and paranoia. The next category of drugs I want to talk about are the sedatives. They sometimes also call these hypnotics, and that means they help people sleep better. So a couple of things that they're prescribed for, and a very common one is anxiety. And anxiety is a very common human experience, but when anxiety interferes with one's ability to work and live and get through a normal day, they sometimes require medication and other treatments. One of those treatments is prescriptions with sedatives. Now, another type of anxiety disorder, very specific type that these medicines work well with, are panic attacks. This is when a person is seized with a sudden fear for no reason, and their heart races, they become very anxious and fearful something's about to happen, when in fact nothing is happening. So medications like the sedatives can be very useful for them. Sleep disorders as well, and muscle spasms. So these medications help relax muscles, and they also help a person sleep better when used in the short term. So you get the combined effects of relaxation, improved sleep, and decreased worry. So in those cases, this is an extremely helpful series of medications. Now, what happens when they're abused? What happens when these medications are not taken under a doctor's direction, but instead are used in higher quantities or more frequently, or by individuals that they were not prescribed for? So one of the effects is memory problems. People often forget periods of time, what they're doing and what happened while they were taking these medications. They can also result in balance problems, and falling is also another common occurrence that can result in serious injuries. People can experience tolerance. That is, while one pill worked for them initially, they now need 2 or 3 or 4, and over time they find themselves having to take more and more medications as they develop a dependence on these. Another issue, and a very dangerous one, is slowing down the breathing center. The breathing center in the brain, which works without us thinking about it and keeps us breathing all the time, whether we're awake or asleep, can be depressed with these medications to the point where it can result in death. So these are this is a very serious side effect from that. And along with that, taking too many of these medications can result in overdose, decrease in breathing, and even death. Another problem with these medications is if a person is taking them on a regular basis over time, they can develop dependence. And then if they stop taking them, they can experience withdrawal symptoms. Now, withdrawal symptoms from the sedatives are some of the worst of any drug. And these can result in serious things like seizures, severe anxiety, the inability to sleep, and confusion. So the side effects of stopping the medications abruptly can be very, very, very serious. And that's why these medications should only be taken under the direction of a physician and in accordance with their prescription, not taking too many, not taking them in ways other than prescribed, and certainly not sharing prescriptions. Prescription is intended for one person, not other people. If other people need that medication, they need to see their own doctor and be evaluated for it. We were talking about examples of sedatives and some of the things that they're primarily used for. And as I mentioned, anxiety and sleep disorders are 2 of the most common. The class of drugs that we think of most commonly used is called Benzodiazepines. So this is Valium, Ativan, Klonopin, some of those commonly prescribed ones. But it also includes another class of drugs called Barbiturates. Now, barbiturates aren't used as commonly anymore in an outpatient basis. They are used in hospitals and in certain settings, and that's for a very specific reason. While all these drugs can become sedating and can become habit-forming, the barbiturates are particularly bad at putting the breathing center to sleep and can result in death. So barbiturates tend to not be used outside of medical settings where there's a very close observation. But they're also sedatives and need to be used with great caution and only under the supervision of a physician. As I mentioned earlier, alcohol is the most commonly used sedative of all. Now, we don't think of alcohol as a drug because it's available at the store. It comes in packaging. We see it advertised on TV. It's associated with good times and sports events. And certainly most people use alcohol in a social, responsible pattern. But there are individuals that find themselves losing control over their alcohol use and use alcohol in irresponsible ways, which can result in serious medical problems, liver disease, heart disease, brain disease, and can result in accidents, which are a very, very common result of alcohol abuse. So car wrecks, accidents around the home from excessive drinking, other things are really serious effects, and we need to think about alcohol as a drug and not give it a free pass. Our next category of drugs of abuse is hallucinogens. Now these come in two types. One is naturally occurring compounds that are found in some plants, like marijuana, and some types of mushrooms. The second type are synthetic or manufactured hallucinogens, and these would include LSD, PCP, also called phencyclidine, and goes by the street name angel dust, and then MDMA, also called ecstasy or mollies. These are designer drugs. They're made in people's basements, garages, other places. There's no quality control on these. The FDA does not inspect them. So there's all sorts of unexpected things in these medications which can result in serious and very difficult side effects. Other categories or classes of the synthetic hallucinogens include ketamine, which goes by the street name Special K, and then kind of an oddly named category called bath salts. Now, bath salts are not bath salts. They're manufactured synthetic hallucinogens. They call them bath salts so they can sell them in stores or over the internet, saying they're for putting in your bathtub. But these are drugs that are designed to be ingested and designed to create hallucinations. They keep changing the chemical structure a little bit so that they're not technically illegal because they don't fit neatly in a particular category from the FDA. But all of these drugs can result in severe hallucinations, bizarre and dangerous behavior, and very, very unexpected side effects. When a person takes one of these, it's very difficult to predict what will happen to them. And our last category of drugs of abuse are the opioids or pain pills. Now these are very important and essential medications for pain relief. They're used widely every day, very appropriately under a doctor's prescription and under a doctor's direction. So some commonly used ones are oxycodone or OxyContin, hydrocodone or Vicodin, and meperidine or Demerol. Percocet would be another category of these drugs which you see quite often. The desired effects are pain relief. So these are often given after severe injuries or after surgery. So why are they abused? Well, they're abused because of some of their other side effects. So in addition to pain relief, some people experience a feeling of well-being with these, or what we call euphoria. They wipe away the difficult, painful thoughts and give them a feeling that everything's good and everything's going well. They can also result in relaxation, and some people experience a sense of increased energy with them. So those sound like good things. So what's the problem with opioids? Well, again, under a doctor's prescription and direction, there's not a problem with them. When they're taken by folks for recreational purposes or to abuse, you get into a variety of problems. One of those is they can put the breathing center to sleep. Much like we talked about with sedatives, these can also result in respiratory depression and death if taken in large quantities. So the overdose is unpredictable. No one intends to overdose when they take these medications. But again, these medications for the average person, they usually don't know the purity, they may misjudge the amount, they get a white bag of heroin, is it really pure or not so pure? And people oftentimes are intending to get high and end up dying or having a severe overdose. Other categories include the kind of naturally occurring ones. These all come from opium poppies, mostly grown in the Middle East, some in Southeast Asia, that then are made into morphine and can be synthesized into heroin. These drugs are often injected, they can be snorted, particularly for the ones that inject them. They're often injected under non-sterile conditions and can result in a variety of infections, including HIV, hepatitis B, and other serious infections and disorders. So in summary, there are 4 classes of drugs of abuse: stimulants, sedatives, hallucinogens, and opioids. If you have additional questions about any of these drugs of abuse, please see your physician or healthcare professional.